Thank you so much for joining me today as we discuss returning to school during a pandemic, equity in the Black community of Long Beach. Although most of our students have returned to school at this point, it's still an important topic because we will continue to be in this pandemic. And so we must make sure that our students are safe. So before we go any further, I would like to make an acknowledgement. The Black community has endured a level of racism in healthcare that is not to be ignored. We acknowledge the fact that our community has endured pandemics in the form of racism, genocide, healthcare disparities, just to name a few. So before we move on any further, we're going to have a moment of silence for those that we have lost during this pandemic. Thank you. So today I will be speaking with you. My name is Alicia Coulter. I am the CEO and co-owner of Advantage Health Now. So let's talk about trusted sources. In this age of social media and different web platforms, we have to discuss what is a trusted source. A trusted source is someone that is rooted and grounded in information that is centered in public health. Public health meaning different agencies like your local municipalities, the federal government, scientists, and others that have researched the information and have brought forth both qualitative and quantitative information. Why are they trusted sources? Because they've done the work, they've done the research, they've done the studies, they've completed the studies, and they're sharing the information based off of facts. That information has also been peer reviewed, meaning it's been researched by other professionals that trust the science. Who is not a trusted source? Well, anyone that is not in line with science. If they're going against the information that has been researched and rendered, then they are not considered a trusted source. When should you verify if a source is valid? All the time. There should never be a time where you're not researching to confirm if someone is a valid source. If you Google search my name, you will see my credentials. You will see that I have been in the trenches and working to help combat not just COVID-19, but other public health disparities that plague both Black and Brown communities. So who can you trust? So when I look at this picture, I see a physician or a clinician or someone that's just in public health, a woman that is saying, oh my goodness, do you really not trust us? Trust your local municipalities. Trust the CDC. That's who you trust. You trust the public health departments within your city or your county to bring you factual information that is rooted and grounded in scientific data. So I'm going to shift a little because I like to focus on trusted sources as well as sharing other health education so that we're on one accord. We're all in the same place as information is being shared. So is there a difference between SARS-CoV-2 and COVID-19? Yes, there is a difference. And if so, what is the difference? So I'm going to try and break this down to you quickly yet concise, meaning SARS-CoV-2, that is the virus that causes the disease of COVID-19. So let's break this down. So you have SARS, and then you have CO, which means corona virus, the V, and then it's number 2. What does COVID-19 stand for? Coronavirus disease of 2019, because that's when it was first found in China, right? Not saying it's the Chinese virus. I'm saying it was founded in China in 2019, and it was given the designation of SARS-CoV-2, the virus, and the disease of COVID-19. So I just explained the difference to you. And SARS-CoV-2, the virus, is a coronavirus that has multiple variants. Okay, the most popular variant that we know of is the Delta variant. That is the one that most people, if you were to test them and do what is called sequencing, you would find that they will test positive for SARS-CoV-2, or when they test positive for SARS-CoV-2, they will then test positive for the Delta variant. Okay. And COVID-19 is a disease that is caused by the virus. So we want to make sure that we designate that. So let's say, for instance, I'm fully vaccinated, plus I've had my booster. Okay. I then test positive. I'm going to test positive for SARS-CoV-2. Okay. I have no symptoms. I don't even have a runny nose. I'm what they're called asymptomatic. And we'll get into that in a bit. But I have zero symptoms. Okay. I do not have the disease of COVID-19. I have the virus of SARS-CoV-2. The moment I start to exhibit symptoms, then I can say I have COVID-19. I don't have SARS-CoV-2 or COVID-19 right now. As you can see, I'm here present with you, but I just wanted to use it as an example to show the difference between SARS-CoV-2 and COVID-19. Okay, so let's talk about symptoms of COVID-19. Now, a lot of times I can tell you there's so much concern the moment you're feeling ill. I know for me, the moment I start feeling ill, I'm like, oh my gosh, do I have the virus? And then if I start sneezing, runny nose. For instance, my family and I went on vacation and we went on an airplane. Upon returning, I knew that I wanted to get everyone tested. Well, upon returning, my husband had a runny nose, he had chills, he wasn't feeling well. Instant nervousness. I'm thinking, oh my God, we got the virus. So the whole family goes to get tested. We're negative. I'm excited. My husband still exhibits these symptoms. So he gets tested again. Well, lo and behold, he's negative. So we were not positive for SARS-CoV-2 or COVID-19. When you have those symptoms like fever, chills, cough, sore throat, you instantly think it's COVID-19. That's your first thought process. That's what most people think. Or you have some people that brush it off. But I say this, always err on the side of caution. If you have any symptom, even if it's the cold, go get tested. It's better to know. It's like HIV. It's better to know your status to make sure that you're saving someone's life versus operating in the space of, oh, I know I'm fine. Never know that you're fine. Always go back to, I want to confirm that I'm fine by getting a what's called PCR test. So they take your nose, the swab up your nose, and then they send it to the lab. Some locations do rapid PCR tests, but those will run you about $200. So if you go to a local testing site at your local pharmacy or your county or city, you'll be able to get tested and confirm whether or not you have COVID-19. It's always better to know than to assume, okay? So I just wanted to, we hear about these variants. We hear about the Alpha variant. We hear about what they call the wild type, which is the original SARS-CoV-2 variant, and then Delta. Delta is the variant that came in and changed the whole game of COVID-19, right? I mean, it came through and showed us our weaknesses. And unfortunately, we lost quite a number of people worldwide because of the Delta variant. So I just wanted to share that there are multiple variants, and we're going to go through the entire Greek alphabet before we contain this virus. Unfortunately, that's what's going to happen. We will have to learn how to live with SARS-CoV-2 because, ladies and gentlemen and individuals, SARS-CoV-2 will be with us. So, the Delta variant. Now, when I created this presentation, the Delta variant was the variant of concern. We have since been confirmed to have a new variant of Omicron. I'm making the disclaimer that we do not have enough information about Omicron to discuss. So I'm going to focus on the Delta variant because we have more than enough data about Delta. So why were public and are public health professionals still concerned about Delta? Because Delta, unlike the original strain of COVID-19 or SARS-CoV-2, unfortunately, sometimes we use those words interchangeably, but it is SARS-CoV-2, right? The original strain, for every one person, 3 people would test positive. So you're at a party at a friend's house with 10 people, and 3 of them are more likely to test positive for the virus. Whereas COVID-19, you're at your family gathering for the holidays, it's 10 of you, 7 people are more likely to test positive if one person is there. And the reason why that is of great concern, chickenpox, which is super duper duper transmissible, can transmit to 10 people for every one person. Now, y'all know the moment your mom found out that your cousin was positive for chickenpox, what did she do? Take you to your cousin's house and let you contract chickenpox. I know I had chickenpox as a child. The issue with that is chickenpox is highly contagious. It can make you very ill. We were truly blessed to not suffer like we could have with that behavior. And thank God for the chickenpox vaccine for that generation that was able to start that trend. I'm not of that generation. I had chickenpox naturally. Nonetheless, this is not about chickenpox. I'm just sharing the why public health is concerned about the Delta variant, okay? I mean, even when you look at measles and mumps versus the Delta strain, okay? So this is very concerning, right? It's still concerning, especially as we enter into holiday months. And this transcends 2020 holidays, 2021, 22 and 2, and so on and so forth. Just like the flu season. When the flu season comes, everyone beware because we know that people are going to be sick. So I talked to you earlier about asymptomatic when we're discussing the different symptoms. So there are 3 different types of infection when it comes to COVID-19. Remember, SARS-CoV-2 is the virus, COVID-19 is the disease. So once you have the disease, asymptomatic, that means you have the virus, no symptoms, yet you're still able to spread that virus to other people. Maybe not as much as someone that's moderate or severe, but there's still a likelihood, okay? Especially if you're not wearing your mask. Moderate, okay, that means you have a runny nose, you're sneezing, you're coughing, you have some chills and body aches. You're not sick enough to go to the hospital, but we're watching you to see if you get to that level, okay? Now, severe. Severe is when you have a fever, when your breathing is labored, okay? Your oxygen level is low, okay? You are coughing, you're sneezing, you have chills, you have body aches, you have stomach pain, sometimes coupled with diarrhea and vomiting. You have all the symptoms, and now you have to go to the hospital because you cannot breathe. Your breathing is labored, okay? And when you get to the moderate level, you want to make sure that you contact your physician immediately or contact those that love you so that they're aware that you're at home, you're not feeling well, because you want to make sure that people are able to check on you, especially if you live alone. So in this space, I always like to ask the hard questions because, and I don't consider this challenge a hard question in the sense of it's hard to answer. It's hard because we don't think about this type of stuff as we navigate through this pandemic until it happens. So I'm going to ask you, and you write down your answer, think it through. If you or your loved one test positive for SARS-CoV-2, what is your plan? If you're an entrepreneur, do you have a savings? Because you may not be able to work. If you are a person that works a 9 to 5, does your employer offer sick time specifically for COVID-19? Some employers offer 2 weeks off, but let's say you need more than 2 weeks off. What is your plan? What will happen with your children? Your children go to school. What happens to them then? Okay, so we have to make sure that we ask those questions of ourselves. So then you have to also ask yourself, if you or your loved one is admitted into the hospital after being confirmed to have severe COVID-19, what is your plan? What will you do? I know of a family that had a loved one admitted into the hospital, and they were in the hospital for almost 200 to 300 days. It's almost a year. This person was the breadwinner. The breadwinner. I know of another person, their loved one didn't get to come home. They too were the breadwinner. What plan do you have? Especially if you're not vaccinated, because you're at greater risk of you succumbing to severe COVID-19. So if you opt not to get vaccinated, you have to have a plan. You can't not be vaccinated and not have a plan. Well, you can, but you shouldn't. You shouldn't. That's not fair to your family. That's not fair to them at all, because they depend on you. You're a resource for them. And in being a resource for them, they need you. And they need your financial security. So what happens? What happens when your child has to return to school and their parent is in the hospital? How will they manage that mentally? When their friends are bringing their parent up to the school for back to school night or for any type of event. If they're in high school, some schools have homecoming fairs or graduation, because it'll be here before we know it. What happens if, the last time they saw you on school campus, you were walking and you were serving one of those parents that was active in the PTA, and now the next time they see you, you're in a wheelchair on oxygen? Because we're going to talk about COVID long haul, because that's something that's near and dear to my heart. But yeah, what happens then? So you need to have a plan. In our community, the Black community, sometimes we struggle with planning because that means that you have to address something that may be inevitable. And we don't want to because it's taboo. If I talk about it, that means it's going to happen, right? That's our thought process. And we don't want to talk about it because we don't want it to happen. Well, if we don't talk about it and it does happen, what do? We put up a GoFundMe. We stand on the corner with a sign asking for dollars and cents from strangers? Or do we prepare for what could happen and have those challenging conversations, especially if you're opting not to get vaccinated? Okay. I know this is a tough topic, and I smile not from laughter. I smile to show compassion and understanding for our community, because we struggle in this, and awareness helps us through our struggle. And I hope my smile doesn't show a level of jovial, but a level of care and compassion for my people. So transitioning, because I also want to educate you. My belief system is centered around educating community that has no education as it is related to the healthcare system or minimal education to the healthcare system, because I can tell you the healthcare system navigating that is a beast. I've worked in the healthcare system, so I can navigate it with ease. And that's why I share my knowledge so freely. So treatments for COVID-19, remember we've qualified SARS-CoV-2, now we're shifting strategically to COVID-19. So remdesivir, that is an antiviral drug that is approved specifically for treating COVID-19. Now, if you remember the previous administration, Trump had remdesivir when he tested positive for COVID-19. He was very sick, although reports state otherwise. But if you look at his list of treatments or therapeutics, as we call them, they were long. He had pretty much everything that's listed out on the left and right column outside of intubation and dialysis. But he had remdesivir. And the thing about remdesivir is it's generally prescribed to affluent communities, or hospitals do not have a plethora of remdesivir available to them. So they preserve it for people that they know will survive if they use this treatment. If they believe after their assessment, okay, this person has a 45% chance of survival, they have to assess to determine if they want to use remdesivir. I'm not using this to tell you that physicians will not treat patients. No, that's not what I'm saying. What I'm saying is they always have to do an assessment as they're doing treatment. And I'm doing this to educate you so that you know if you're not vaccinated, the risk that you're putting yourself in, okay? So we have remdesivir that's approved, and then everything else is emergency use authorization. Everything else is not approved. Monoclonal antibodies are not approved. Various antiviral drugs are not approved. Immune modulators, not approved. Sedatives, not approved. Renal replacement therapies, meaning dialysis, not approved for COVID-19. So basically, if you talk to a healthcare provider, they will tell you we are fighting the symptoms. That's what they're treating. They're treating your symptoms. They're treating your fever. They're treating your kidneys that may be failing. They're treating your lung capacity, your inability to breathe by intubating you. They're giving you an immunobooster in hopes that your body can do what it needs to do to fight. And they use antiviral drugs to try and fight this virus. And the monoclonal antibodies, they're the golden child next to the vaccine, which we're going to get into, because I wouldn't let you leave without talking to you about the vaccine. By no means would you think that. So I wanted to just share the treatments with you, because so many people understand treatment versus preventative care. So we're going to get to preventative, but I wanted to talk about treatment first. Now, they're talking about there are pills that are under that are not approved yet, and they're not even in use. And I know people are waiting for that. So that's why they're not on this list, because they're not even under emergency use authorization yet. Both Merck and Pfizer have a pill, but it's not out yet. This or that. Emergency use authorization versus FDA approval. What are you going to choose? Pfizer's vaccine that has full FDA approval for those are 18 and over? Or are you going to choose the option that is under emergency use authorization? Emergency use authorization or the vaccine that has been used in over 4 billion people worldwide, okay, what you're going to do? You're going to choose the EUA or fully approved, okay? That's the question you have to ask yourself. That's one of many questions, if you're not vaccinated yet, that you have to ask yourself. What would you prefer? Would you prefer them to try and get you to survive? Or would you prefer a preventative measure? So preventative care is to help prevent moderate to severe reaction to SARS-CoV-2, which then becomes COVID-19. That's to even prevent it. But if you're not using preventative care, that means the virus gets into your body, then you are more likely to succumb to moderate to severe COVID. And now they have to fight that versus allowing your body to fight it before it even gets to the point that it is COVID-19. And that's what the vaccine helps to do. It wakes your body up in preparation for that. It's literally an armor to help prepare your body for a fight. That is what it's for. It's there to help you. It's there for your body to use what's already inside of you. Because I know a lot of people are like, oh, I believe in natural remedies. I believe in using zinc and vitamin C. Well, this vaccine is as natural as you get. It is as natural as you get because it is a way to boost your immune system in preparation to fight this virus. My body is ready, and I am so excited about that. And I want you to be excited about that, and I want your body to be ready to fight SARS-CoV-2 should you test positive, okay? I'm gonna always defer back to this, okay? So you wanna wear your mask correctly. You wanna social distance. And you wanna get vaccinated. So when we initially created this webinar and presented it, we had a 12 plus for Pfizer approval. Well, now we're at 5 plus. Now we're at 5 plus. So little babies that are going to kindergarten, they could be protected. Mommy, daddy, loved one. Our babies, come on. I have children, and full disclosure, all of my children are fully vaccinated. Okay. I have an 18-year-old that will be 19 in January. She's boosted because she's on a college campus and she shares a dorm with 2 other people, and we don't know who they're around. So we have to do the best we can to protect her while she's there. Because when she comes home, guess what? She puts the whole family at risk every time. And I'm nervous every time. With that said, we got to wear our mask. When you wear your mask, I still see this. I still see noses exposed. And when I tell you it is, I have to woozah when I see a nose exposed, because I'm like, are we still exposing noses? We've been wearing masks since 2020. And they've been saying, make sure, now I have glasses. So I deal with the fog situation too, for those that have glasses. Nonetheless, I'd rather foggy glasses than to test positive for SARS-CoV-2. If I could just be real for a moment. Make sure that mask sits right here. You want it to sit right here. Cover that nose. Hook those things behind your ears, under your chin. I always buy the surgical masks. Like when I buy them, on the box it says surgical masks. So I pay a little more for my masks because they're 3 to 4 ply. I pinch the nose because it has that metal compartment to make sure it's sealed. I buy the KN94s for when I travel, because it's just so important to have that extra level of protection. Social distancing. That's, I'm gonna be honest, for me, that's the best part. Like personal space, personal space alert, right? You want people to respect your own personal bubble. Social distancing. If you don't know the person's status, it's just like I said it earlier, HIV, know your status. When it comes to SARS-CoV-2 and COVID-19, you gotta know your status and the individual that you're near. If you don't, socially distance. Now, if it's your family that you reside in your home with, please don't say that Alicia told you to socially distance from your family, because I didn't. Okay. Strangers or individuals, unfortunately, at our schools, we do not have a social distance order, but we do have the students wearing masks indoors. Now, my kids, they wear their masks outdoors as well because mama told them, keep your mask on unless you're eating, and try not to canoodle with your friends while you eat. If you do, keep it at a minimum. Okay. And that vaccine still reigns supreme for 5 and up. Okay. So please, I beg of you, please, please, please wear your mask, socially distance, and get vaccinated. Now, I know some are going to say, Alicia, why don't you have hand washing on here? Hand washing is important, period. Like your hands should remain clean. It's just the hygiene is great in general. It's just these 3 things are the top. This is the platinum level when it comes to combating this virus. Okay, I've asked you this before, but I'm going to keep asking you because the research is showing, the data is showing that the Black community is the least vaccinated population. So we have to have these difficult discussions. Like, we got to, because if we don't, who is that going to benefit? It's not going to benefit us. So to reduce you and your family's exposure to SARS-CoV-2, what will you do? Let me tell you something. 2 things. I had an event at my home. I had 4 ladies, all that I know that are fully vaccinated and are regularly tested for their job at my home. That's it. 4. That's how I reduce my family's exposure to SARS-CoV-2. I opt to operate in a bubble. There's a vaccine mandate to come into my home. Okay. And if one individual is like, if I have a service provider, I can't control that, but they do have to wear their masks. And I wear my mask and I stay away from them because to protect myself, yes, to protect me and to protect them. Although I know that my risk for exposure is very low because of how I function. Because I asked myself, what will I do to reduce my family's exposure to SARS-CoV-2? I was invited to a party. I'm not going because I don't know if there's a vaccine mandate. There wasn't any information on the invitation. I don't know if there's a testing mandate prior to attending. There wasn't information on the invitation. So my assumption is that none of those things are needed in order to attend. Sometimes you just can't go. It's like we tell our kids, you listen, you can't go everywhere. You can't be friends with everyone. You can't hang out with everyone. That's what I do to reduce myself and my family's exposure to SARS-CoV-2. What will you do to set up a plan just in case you test positive for SARS-CoV-2? So when I ask that question, I mean, do you have enough space in your home for you to isolate away from your family? Do you? Do you have a second bathroom? And then yet again, if you or a loved one is hospitalized with COVID-19, what will you do? The emotional toll that takes on families, I can't even express. I can't express to you what that looks like. We have to ask these challenging questions, family, because what happens is we put ourselves at risk for succumbing to this virus and this disease with no plan in place and begging strangers to manage us. And I can tell you, I have friends that are wealthy. They're not excited when they see GoFundMe's. They're like, another one? Why won't these people get vaccinated, Alicia? That's what they ask me. That's what they ask me. Why won't they get vaccinated? What is the reservation? It's been a year. The vaccine was rolled out in December 2020. The trial started shortly after we knew about the virus in March, April of 2020. They asked me, why? Why won't they? What is keeping them? I ask you, why won't you? What is keeping you? So I'm going to tell you, this data on this slide, it fluctuates. So today you may look at this data and it says this, tomorrow may say something else. So we're discussing Long Beach. Black people make up 12% of the population in Long Beach, but yet 14% of the positive cases of SARS-CoV-2 are from Black people. So you never want a number that represents something negative. Having SARS-CoV-2 is not a positive thing. That's a negative thing. You never want that larger than the population you're talking about. So since the population size is 12%, you would want this number to be single digit. You want it to be like 5%, and then we'd be excited. You don't want it to be not 0.1% above. We make up 12% of the hospitalizations and 14% of the deaths, and yet 8% of the population that is getting vaccinated in the city of Long Beach, Black people. So if you look at a pie chart and you just say, Black people, everybody else, right? You look at that pie chart. I want you to visualize it. Visualize the pie chart. 8% would be so small. And then you have 92%, everybody else. We make up 8% of the vaccines over 18. Now, that number could have gone up. Nonetheless, it's still low. It's still low. So bear with me for a minute. I am going to share a video with you. And as I load this video, I'm going to prepare you for the video. The video discusses COVID long haul. Now, if you remember, I told you that COVID long haul is a near and dear subject for me. And I'm going to tell you why. It is a near and dear subject for me because that is the reason why I got vaccinated. I've heard story after story after story of individuals that suffer from COVID long haul, okay? And with them suffering from COVID long haul, what happens is their lives are changed forever. But I'm gonna share this video about a young man because I continue to hear these stories about people saying, COVID doesn't affect young people. It only affects older adults, which the level of irritation that I receive when people say that I can't really I can't really put it into words because people are people. I don't care what their age is. Are we saying that older adults deserve what they get? Is that what we're saying? I hope not. I hope that's not what we're saying. Okay. So I'm going to share this video and then we're going to come back and we're going to talk about it. Before I share this video, I'm going to let the, I'm going to let the, I'm going to let the commercial for per se run through and then I will share my screen. But while we wait for this, just know that it is important to know that all of our citizens of the world are vital to us, no matter their age. Everyone is of importance and serves a purpose. So now we're done with the commercial and I'm going to share the video.
Kevin Bass was an active and good-spirited 5-year-old boy. Then one day last December, before vaccines were widely available, Kevin lost his appetite and said his head hurt. Angela Bass took her son to the doctor where he tested negative for COVID. But even after days of high fevers, stomach pain, and a rash, doctors in the emergency room sent Kevin home.
So I kept going back to the ER saying this is not normal. And I think on the second time that I went to the ER is when people started to really take me more seriously.
A rare illness linked to COVID-19 is reappearing in children this winter.
By then, Angela had learned about a post-COVID condition called multi-system inflammatory syndrome in children, or MISC, and Angela pressed the doctors.
You know, I asked specifically, like, could this be MISC? I saw it on the news. I saw and there's another family that I knew whose little girl had the same symptoms, and I asked specifically, and they were like, no, he hasn't had COVID, so it's probably not MISC.
But follow-up tests showed dangerously high markers for inflammation, and a blood test found antibodies for COVID. That meant Kevin had been infected perhaps weeks before, but never showed any COVID symptoms.
His eyes were swollen shut, his face was like huge, his legs, like everything was just really swollen, and it was getting like in his lungs. He had fluid on his heart, and he had to get a blood transfusion because he lost blood.
He was really sick.
He was really sick. I was really preparing myself for the worst.
Kevin spent 15 days in the hospital.
As soon as I got from the hospital, I couldn't run.
Why not?
Because my legs were swollen. Every part of my body was swollen.
My God, wait, was this the bear that came from the hospital when you came home from the hospital?
Yes, it's my favorite bear.
About 2 out of 3 kids with multi-system inflammatory syndrome are Black or Hispanic. To understand why, a massive National Institutes of Health research effort is probing everything from genetic factors to repetitive exposure from parents considered essential workers. Angela Bass says doctors also need to be aware that MISC might look different in Black and Latino children.
To me, like, I could see the rash. It was all over his belly, all over his arm, and I was like, there's a rash there, you know, please look at it. And they were like, okay, you know, are you sure? And I saw some of the images on the internet, and they were, you know, very much more pronounced, but they were on like very like white bodies, and his skin is darker.
But children of color aren't the only ones affected. Angela Bass joined an online community of mothers supporting each other, often when the medical community wasn't. There, she met Leanne Henderson and her 14-year-old daughter, Allie. So little is widely understood about MISC that doctors mistakenly removed Allie's appendix before realizing that she was having a near-fatal inflammatory reaction from an undetected COVID infection. While it's unclear what the longer-term impacts will be, researchers agree that kids with long-haul COVID and MIS-C will need to be followed closely for the next 5 to 10 years.
Surprisingly, the MIS-C kids have actually done fairly well.
The good news, Dr. Hassan and her colleagues say, is that many of these children, if treated, do improve with time, though it varies widely from case to case.
I'm gonna be down here waiting.
Kevin is back on his four-wheeler. Allie recently played softball in the World Series in Panama City, Florida. And even Yasmin, who still suffers from long COVID, can now take short walks with her mom, step by step, getting back to the business of being a kid. For the PBS NewsHour and Kaiser Health News, I'm Sarah Varney in Elizabeth, New Jersey.
So, this is why we continue to talk about getting vaccinated. COVID long haul. So initially the data was showing that about 1/3 of individuals that tested positive for SARS-CoV-2 had the layman's term name of COVID long haul. There's another name, it's so long, it's not even worth it because it's just too long. And you should remember COVID long haul. Just think of it as you had COVID and for the long haul, like, oh, I got over the virus, the disease, I don't have the symptoms, but God, this virus is with me for the long haul. That's what that means, basically. Now, to my brothers, one of the side effects or one of the adverse effects, because they talk about adverse effects of the vaccine, one of the adverse effects or adverse events per se of COVID long haul is ED, erectile dysfunction. They have found the virus in fluid from men's member, their penis. Okay, so one of the issues is men not, and I'm not laughing, I'm more or less just like, this virus is like the gift that keeps giving. So if you are young and you still want to have kids and you still want to be able to enjoy relations, get vaccinated, because getting the virus could cause you your ability to enjoy one of the most natural events, sex. Pulmonary disease. There are people that I know of a woman specifically who is a physician and she's an awesome human who is on oxygen. And when she speaks with her nasal, what we call nasal cannula in. Her speech is so labored. It hurts my heart. We do speaking engagements together. As of lately, I have not seen her in any of the speaking engagements that I do, at any of the speaking engagements. We haven't done anything together in a while. So I need to check on her. Brain fog. Now, I'm gonna say this. This is what I'm most concerned about for the Black community, the brain fog. Because specifically Black women, we will say, girl, I'm tired. I just can't remember, I'm old. We will dismiss brain fog as being old, being tired, overworked. We will act like it's just a symptom of life versus this could possibly be a side effect or an adverse effect of COVID-19. But we'll ignore it and not get treated. I'm concerned for us because Right now, we're in the short term, almost 2 years into this virus. That's short term. 2 to 5 years, short term. 10 years, full decade later, that's the long term. People talk about, I get vaccinated, I'm afraid that when I turn on the TV, I'm going to see a commercial. If you got the vaccine, please call 555-1212 to talk to this attorney group to discuss monies that may be due to you because of. No, it's not going to happen. What you'll see commercials for 10 years from now saying, if you had COVID-19 in 2020 or 2021, call this number to be a part of this trial. If you are suffering from forgetfulness, the inability to do simple behaviors, activities of daily living, meaning washing your body, cooking your food, that's what you're more likely to see. And as Black people, we already see the side effects of systematic racism in the healthcare system. So now we add COVID-19 on top of that. Then you add COVID long hauler on top of that. Now we're starting to just compound. When we can alleviate COVID-19, we can alleviate COVID brain fog by getting vaccinated. Systematic oppression, systematic racism within the healthcare system, you have people like me that are constantly just, I needle at that every day of my life. It is why I was placed on this earth. That's why I'm doing this webinar. Because I believe in you. And I believe we as a people can take our hurt and our pain that was passed down generationally and hurt and pain that we have suffered from the healthcare system. Specifically to say, you know what? I'm not going to carry that when I go get vaccinated, because I understand this vaccine was not made just for Black people. Now, if this vaccine was made just for Black people, I'm not gonna lie, I probably would pause and say, okay, hold up. Why y'all making a vaccine just for Black people? Shouldn't this vaccine be for everybody? Shouldn't it be for everyone? It shouldn't just be for Black people, right? But no, this vaccine is inclusive. Pfizer is sold all over the world. Moderna is used all over the world. It's not just used for Black people. And I don't know about you, but I remember turning on the news one day back in like January, February, March of this year, and seeing a certain group of people lining up outside of a vaccine clinic in South Central, waiting for Black and brown people not to show up and get vaccinated so that they can get the leftovers. I'm not saying that's what makes it better. I'm saying pause. Think about that. What do they know that you don't know, that I don't know? I can tell you, they got vaccinated and took our resources, and we freely gave them away because of a fear that we have that is warranted. That fear is warranted. I am not negating that fear. I fight systematic racism every day of my life. Every day. That is what I was put on this earth to do, is to fight for us. I will say this vaccine is not a part of that. Not even a little bit. This is our shot at equality, no pun intended. But hey, if it works, this is our shot at equality within the healthcare system. This vaccine, this is the one time we get it so that we don't have to deal with this. Rising number of children struggle with COVID's effects, especially in Black and Latino communities. We don't want our babies with this. Now, the kids recover, but 10 years from now, we don't know what that looks like for their bodies. We don't know what that will look like for your body. I need you to think this through. If you have not gotten vaccinated or you know someone, get vaccinated. Send me a message. Send me a message. I will respond. I'm passionate about this. So specifically at Long Beach Unified School during a pandemic, initially there was weekly testing for unvaccinated staff and students. They've since removed that. But you do have to wear your masks indoors 100% of the time. There is no mask mandate for outdoors. Now, social distancing when available. I threw this in there because I want y'all to do that. Have your kids socially distance when they can, especially those high schoolers, because we know those high schoolers like to touch and kiss and hug, and let's not act like we don't know what high schoolers do. And junior hires too. I mean, it's not just high schoolers. We're not going to talk about the babies because I'm not having that conversation. But we know that middle schoolers and high schoolers like to touch one another. So if they can socially distance, I know it's hard, but we got to educate them. They need to know. They have to know, okay? Now, let's get this straight, because I love talking to my people and having a conversation with you in our language. So that's why I said, let's get this straight, okay? The Black community needs equity and inclusion in order to combat healthcare disparities and implicit biases in healthcare and education. Now, I told you before, this is my life's mission, is to serve in this space, to advocate for you. So I will always call it out. As much education as I've given you, as much as I've held you to the fire about decisions you need to make, I will always bring it back here. We need this. We need equity and inclusion to combat these things, because I put implicit biases because, you know, that's a cute phrase. I want to take off the implicit too, because some of these biases are not implicit, i.e. Black people are able to experience more pain, i.e. Black people have a thicker skin. You know, they believe that. And we help perpetuate it when we ignore the pain that we're suffering from. Shout out your pain. Let it be known. Do not ignore your pain and suffering. It is of the utmost importance that we get this and that we shout to the rooftops. We continue to push. That is a must. We must continue to push the level. We must. Do not give up. And do not give up on your shot for equality. This is our shot. This vaccine saves lives. Right now, over 95% of the people that die with COVID are unvaccinated. The other 5%, and I'm using with intentionally, the other 5% that die with COVID are vaccinated, but they have other underlying conditions, meaning they're already immunocompromised. And we throw out this word like it's just a simple word. They're already sick. They already have another disease that they're being treated for. It's basically what immunocompromised means. So SARS-CoV-2 enters into their body, their immune system can't rapidly respond because it's like, okay, wait a minute, stop. What are we fighting here? Are we fighting HIV/AIDS or are we fighting SARS-CoV-2? I need to know. That's what the body is saying. I need to know. Let me know which one I'm supposed to fight because I'm tired already. That's pretty much what the body is saying. And the body says, I give up. I'm tired. I'm done. And unfortunately, when the body gives up, how do we survive? Medicine can only do so much. The body has to do something. So we need equity and inclusion in order to combat these things. But I'm gonna always come back to y'all because we gotta be community minded. So what is our role in combating SARS-CoV-2 and ensuring equity and inclusion? What is our role? Ask yourself that. I'm gonna tell you, getting vaccinated is number one. Number two is wearing your mask. Number three, not having parties during a pandemic. Number four, don't go to the club. Number five, COVID exists. Don't play me. Okay? COVID exists. Don't play yourself. Do not play yourself in these streets. Number seven, if you travel, wear your mask. Get tested before and after. If you're going to be there a long time, during. I mean, there's so many things. Protect our elders. Do not go visit Big Mom or Papa when you just came from the Dominican Republic. Don't go see them. Wait 10 days, self-quarantine, and I don't care that you missed them. Don't do that. Oh, let me share a story. I share stories because I want this to resonate with you. If you are a caregiver and you're not vaccinated, be mindful of the risk that you put your loved one or your patient in. Someone that I love dearly, that I called Auntie, and you know how we do in our community, we give these titles, the title of Auntie and Uncle to people that are like family to us. They are our elders, but we love them so. My auntie had a caregiver that wasn't vaccinated. Caregiver came to the house, gave my auntie SARS-CoV-2. My auntie got admitted into the hospital and didn't make it home. That's not community minded. She didn't protect her. Our elders are our treasure. How can we ask for equity and inclusion when we aren't acting in that space for ourselves? How? Model the behavior that you want. You got to model the behavior that you want. Another family member of mine, caregiver, I needled her as much as I could. She finally got vaccinated. She was caring for older adults. I'm like, how do you care for older adults and you're not vaccinated? What is your problem? And then out at the club, posting on social media. Like, that's not fair. They're vulnerable. There are elders, like, respect them. They have stories that they still need to tell. They've seen things that we will never see, and they can share that with us and our children. And goodness, if we could be so blessed, our children's children. Because remember, we are generationally mindset. Let's stay in that space with this virus and protect our elders. What choice will you make? I'm serious, y'all. We we get mad about the mandates. We get mad about them wanting to, give incentives. We mad about, them saying you can't work if you're not vaccinated. Mad because they're giving out a Nintendo because you give out. It's like nobody can win for losing. So take all that away. What choice will you make? What you gonna do? You gonna continue to talk about, oh, look, we got this new variant and they said the vaccine may not work. See, that's why I didn't get vaccinated. Huh? The vaccine been working since day one. Since day one. And until you know for a fact, the vaccine still works. And even, so what? Not getting vaccinated, we know that does not work. That's a given. We gotta, our reasoning. We gotta process through this differently, y'all. Get vaccinated, please. So I want to thank you. I know I fussed at y'all a little bit, but that's what family does. Like, we wouldn't be family if I didn't fuss at you. We're family. And I believe that. Like, when I see Black folks in the street, you sis, you bruh, you family. I don't care what you look like. I don't care what your sexual orientation is. I don't care what gender, religion or not, belief system or not, atheist or not. You're still my family. And that's why I do these webinars, because I want you to get the information from someone that looks like you, that speaks your language, but also speaks their language. So I understand. So please, if for no other reason, get vaccinated, because this is your shot for equality. This is your shot to save your life. This is your shot to save your family member's life. I care about you. I don't even know who's watching this, but because you look like me, I care about you, because remember I said, this fight is the reason for my existence, and I'm passionate about it. You see my handles, hit me up in my DMs. This will be dropped on YouTube, so feel free to hit me up in the message. I'm not going to ask you to like it or share it or subscribe, because, share it, yes. Not because I want you to share it for me to get clout. Come on, are you kidding me? Could care less about that. I want you to share it to share the knowledge, to share the good news with our people. That's why I want you to share this. But hit me up in my DMs if you have any questions about the vaccine, because this is hard. I'm going to share one more story really quickly. I wasn't going to get vaccinated. Ooh, Alicia. I had my master's in social work and my master's in public health. I wasn't going to get vaccinated because I'm still Black. That's my identity. And I still struggle with trusting the system. But after I listened to professionals like me that work in this space, I said, you know what? Let me do my research and stop playing and keep my Black identity, but add on top of that, my academic success, and use that to fuel my understanding of why it's important to get vaccinated. So I scheduled my appointment. I went and got vaccinated. I remember before I left, one of my kids said, "Mom, did you pray? Are you sure?" I said, "I prayed and I have peace because I don't want this virus. I've had my booster. I'm fine. Actually, I'm in the best shape of my life. And I want that for you too." So I appreciate you for taking the time to watch this. And if you decided to get vaccinated because of this, please tell me. I want to know. I like hold that as a badge of honor. I have a few people, quite a few people that I've shared in spaces with that have gotten vaccinated because I try to make the messaging as clear as possible. So if I've said anything that's caused you to have any questions, send me a message so that I can clear that up for you because there may be others. So thank you again. And I'll see you in these COVID streets. Have a blessed day.